Welcome to today's COVID-19 update. I'm Felicia Valenzuela, and we're speaking with the Honorable Minister of Health, Dr. Frank Anthony.
Well, thank you once again for having me in your program.
All right, let's jump right into it. Can we have an update as to what's going on in Region 1?
Well, again, we have seen a few cases more in Region 1, and that's because of the monitoring that we've been doing and the testing that we've been doing in Region 1. So today we have 92 active cases in Region 1. And as you know, we have focused a lot of our attention on Quibana, where we've seen a spike in cases. Today we have tested now a number of persons, and we have 61 active cases in Quibana. We continue to have a team on the ground that is doing sanitation of the residential facilities and also offering education and advice to the residents on how they can quarantine themselves within their own homes, and those persons who have been tested positive, what precautions they need to take in terms of isolating themselves. So our team there continue to work, and we have been collaborating with the authorities in the village to ensure that we have a lockdown in place. So I think so far that has been working. And those who present with symptoms or we think who would have been exposed, we continue to test them, doing PCR testing, sending that out to the National Public Health Reference Lab so that we can get a more detailed picture of what is happening in Quibana. We expect that within 2 weeks or so, that the situation at Quibana would be brought back under control.
All right. Previously, when we had spoken, you had indicated that the ministry would had ordered some antigen tests, and these would be effective in those outlying regions.
Well, we have ordered the tests. As you can imagine, countries around the world are trying to get the same tests. So we have put in an order with PAHO, WHO, and we are waiting on the details about when that would be arriving and so forth. We have also looked into the possibility of ordering other tests that the WHO have certified, and perhaps to use a different source in order to get them. So those right now we are exploring, and but we haven't really formally placed an order with the other source. We have placed through the PAHO WHO mechanism for now.
All right, but across the board, our testing generally across the country, it has increased tremendously.
We have the capacity now to do between 450 to 600 tests per day, and we are working to take that up to maybe about 1,000 to 1,200 tests per day. So that work continues. So capacity at the National Public Health Reference Lab has increased. In terms of getting samples, that really has to do with the regions themselves going out and proactively testing people once they meet the criteria or they feel they were exposed. So those samples, once they come into the Public Health Reference Lab, we are able to process them. But again, it comes back to individual regions being more proactive in how they reach out to people and be aggressive in terms of getting people tested. We have seen some regions where this is happening very easily, and they have put up all the mechanisms, and they have been sending a lot of samples to the National Public Health Reference Lab. And there are other regions who have been sending less samples. We have been engaging them and pointing out to them that with the size of their region and so forth, that perhaps they need to be more proactive in doing testing and setting up other testing sites within the region. And so those measures are being taken. So, we're working at this.
All right, can I just ask you, how is the team handling being on the ground in Region 1? How are they faring? Any reports from that?
Nothing unusual. Most of the cases that we have had so far that have tested positive, they're mild. Again, we have put mechanisms in place if they need hospitalization that we'll be able to hospitalize them. And if anyone deteriorates and become severely ill or critically ill, that those persons can be moved and brought to Georgetown. So those mechanisms are in place. But fortunately, so far, most people are experiencing the mild form of COVID, and we are monitoring them.
All right, Minister, if I can just ask for a matter of clarity, when a test is done, a lot of people have basically said when once they're negative or seemingly negative, they're unsure because they don't get a call back. Could you clear that up for us? From the time you're tested, what happens? Yeah.
From the time a sample is taken, that sample then is placed in a special medium. So let's say somebody in Region 1. If you meet the criteria for testing, and we went through those already, frontline worker, hospitalization, and if you have signs and symptoms. And now we have extended that to persons who believe that they have been exposed. So if you meet any one of these, conditions, then a sample would be taken. That sample is then placed in a special container, stored properly because you have to store it at a required temperature, and then sent to Georgetown. Once it arrives at a lab in Georgetown, it then goes through a process again of labeling, documenting, and so forth. And then they would proceed in processing that sample and ultimately running the test on the sample. Once those results are generated, we would then inform the doctors who have sent the sample. So whether it's positive or negative, that result is generated and sent to the doctors who have requested the sample, who took the sample off. It is that doctor's duty, so to speak, to then inform his patients. So whether it's positive or negative, they would do that. They will call up the people and inform them. In the regional task force, we have asked that they set up a kind of surveillance team, and maybe the doctor would not call every single individual, but would have a member of the medical team there to reach out and call the person to say, we got back your results and it's negative. Or we got back your results and it's positive, and here are the steps that you need to take. Right? So that's how the system is working. If persons require a printed certificate of their results, that too can be generated, signed by the appropriate authorities, and given to them. So this is how the results are given to people. Generally, I think the doctors have focused on the positive persons who have tested positive, because you want to ensure that these people are informed as fast as we get the result, so that we can start getting them to take all the necessary precautions and so forth.
Minister, thank you for that clarification. Let's now move over to vaccine. Now, the World Health Organization has called for global solidarity in the rollout of any future vaccines to ensure that those poorest countries, get theirs. In terms of vaccines for Ghana, well, you've already updated us on this, but just reiterate again for us, what is the rollout plan like when we get a vaccine?
Well, again, the quest for a vaccine is ongoing. There is no effective vaccine as yet. There are a number of vaccine that are right now undergoing clinical trials, and we have been working with a mechanism called COVAX, where you have the WHO, we have an organization called CEPI, you have another one named Gavi. All these organizations have been part of this COVAX mechanism. That mechanism really is to be able to get monies, to to first of all identify vaccines that we believe might be viable, and then to immediately pay manufacturers to start working on manufacturing these types of vaccines that they think would be viable. So that's a work in progress. None of the vaccines have been cleared yet for manufacturing. Maybe by the end of the year, we'll start having some of them. And therefore, we'll have to wait and see. The 9 vaccine candidates that this mechanism have been working on, they are waiting now the results of the phase 3 trials. And when we get those results, we'll know probably how effective they are and how they will be able to provide some level of immunity and things like that. So it is a work in progress. And we have been in this mechanism to be able to acquire a vaccine. Now, through this particular mechanism with COVAX, they're aiming to have 2 billion doses of vaccines by next year, later next year. But 2 billion doses of vaccines would not be enough for the global population. And therefore, there'll still be a lot of people who would not get the vaccine when it becomes available. So what they've asked us to do is to start thinking about how we will allocate the vaccines when we get them. And the way that we are working on to allocate is based on risk. The people who would be at the most risk are frontline health workers, and therefore we feel that these categories of persons, once we get a vaccine, that they should be able to get the vaccine first. The initial set of vaccines per country, well, how the COVAX mechanism is going to allocate it, in phase 1, based on your country's population, they'll give you 3% of, 3% of your country's population. So that's phase 1 allocation. Then phase 2, they'll give you 17% more. So between phase 1 and phase 2, you will get 20% of the vaccines. And then beyond that, there will be a phase 3 and phase 4. But the first set of vaccine, every country that is part of this COVAX mechanism, first phase, 3% of your country's population. Second phase would be the 17%. So in our case, once we get 3% of our country's population, we believe that that is enough to be able to cover all our frontline health workers and other frontline workers. We can expand it to cover other frontline workers. Then with the second phase, where we are getting 17% more, our intention then is to look at the people who are at risk for the disease, and those persons would include persons who are older, so maybe 60 or 65 years and higher, because we have seen that they have had an increased risk of mortality or dying, because most of our deaths happen with older people. So they are at extreme risk, and therefore we want to be able to immunize them and to prevent the disease from spreading in this category of person. The other group of persons also would be people with chronic non-communicable diseases. So diseases such as diabetes, hypertension, cardiovascular diseases, kidney diseases, respiratory diseases, and so forth. Again, because we have seen persons with one or more than one of these types of disease are at increased risk for COVID-19, and therefore we believe if we immunize them, we'll be able to protect them. There are also persons with certain categories of infectious diseases, such as the immunocompromising diseases like HIV and so forth, because it's affecting your immune system. Again, those persons who have these challenges, we want to immunize them. Cancer patients, we have seen they are not faring well globally in the epidemic with COVID, and therefore we will want to also put these categories of patients to be among the first to receive the COVID-19 vaccines. So our allocation is going to be based on your risk, and we think that's a fair way of allocating. And then the rest of the population, once we start getting more vaccines in the phase 3 and so forth.
Okay. Minister, if we can discuss the curve, how is it right now as we speak?
So the whole concept of a curve is once you have active cases, you would see the cases going up. Because from one case with this particular disease, there's something called a reproduction time. And with one active case, in some parts of the world, you get 3 other cases if there's nothing done to impede the spread. In other situations, you probably see 2, and so forth. So once you have a case, the possibility is that this case, this one person can infect maybe 2 or 3 other persons, and therefore you can have very quickly more persons getting infected, and you have a faster turnaround time if nothing is done to stop the spread. So we have been monitoring that here, and currently we have about 600 and something active cases, and we know where those cases are, we know which regions are more active and so forth, and we have been trying to curtail spread within these regions and to slow the reproduction time, to slow the amount of people getting infected and so forth. Now, what that allows us is once we know how many cases we have, where they are, we can also anticipate with our health system how many beds we would need, and how many people would require hospitalization, and whether we'll have enough beds if people really get sick and they require hospitalization, whether we'll have the required beds to treat them. So over the last 2 months, 3 months, we have been working to ensure that we have adequate amount of beds in our regional hospital and the national hospital and the facility at Liliendal. We have been working also to make sure that we have critical care beds, meaning that you have equipment such as ventilators and so forth available if these persons require those types of interventions. So we have been putting that in place, and of course trying to get the types of medication to treat COVID-19 once people become severe or critically ill. So we have expanded our hospital bed capacity and expanded our capacity to treat patients with these conditions in the hospital. So the whole concept of flattening the curve is to slow the pandemic so that you can build hospital capacity to treat with the disease. If you don't do that, what you'll see an exponential rise in cases, and our hospital system would not be able to cope. So by slowing the curve, you're able to, or flattening the curve as the term that is being used, you're able to slow the amount of people getting infected so that our health system can cope with the patients who become infected and require hospitalization. And we have been doing that. We expect, for example, that the Ocean View facility, you know that we have been working on the ICU area at Ocean View. And so by the first week in November, we should have those ICU areas up and running. That's our goal, to have those beds up and running. We have about 25 ICU beds that we want to put at Ocean View. And once we are able to get those beds up and running, then we will transfer a lot of the work that we are doing at Georgetown Hospital over to Ocean View. So, it's a work in progress, but, we have been building hospital capacity, building ICU capacity. So if people get extremely ill, that we are able to provide them with care.
That was my next question. Just as we wrap up, can I just get some brief comments from you on COVID curve? I know you've been going to the different regions and your ministerial colleagues as well.
So we have weekly fan out ministers, the joint services, other volunteers have been going out to the different regions, and that is going to continue. The joint services have really been playing a very proactive role. They have been out there, the ranks have been out there talking to people, helping with the distribution of flyers and educating people on a one-on-one basis. They have also been sewing masks and distributing these masks to the general public, those who don't have. And we have had the private sector also contributing to this exercise, because the private sector has been collaborating with the police by giving them the cloth, and the police have been using their resources to be able to sew these cloth that has been donated by the private sector and make them into masks. And then the ranks who are participating in Operation COVID Curb would take them out with them when they're going out on patrol and so forth. And if they see people who are not wearing masks, they will talk to them, they warn them, and they'll give them masks to wear. So it is a collaborative effort, and I'm happy that we are getting so many people participating in this operation. But we still need many more. So if we can encourage more people at the village level, to take on more responsibility, leaders at the NDC level, at the RDC level, we need to see more of them coming out and talking to people. We need more religious leaders to be on board, to talk to their congregants, to make sure that they are aware of COVID-19 and how it's being transmitted and what can be done to protect themselves and so forth. So everybody in this society who have some level of influence can help us to extend this message, to amplify this message, so that we can keep every single Guyanese safe from COVID-19.
That's it for today's COVID-19 update. We've just spoken with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the ministry's website as well, health.gov.gy, and of course our social media platforms.